The 2021 Savannah Regional Annual Review Meeting of the National Health Insurance Authority was an opportunity for operational activities to be peer-reviewed. District managers and staff of the authority in the region discussed particular innovations to be adopted to improve delivery. Out of a population of close to 700,000 people in the Savannah region, active membership of the authority as at year ending 2021 stood at 329,445, representing 50%. Mobile renewals stood at 114,731, representing 51% of the target for the year. Dauda Mahama is the Savannah Regional Director of the authority.
Under the year review, we have been able to achieve 329,445 active members, which represent 50% of the population. Means that we still have a lot to do. We are 600 and over, we'll be able to achieve 300, so we still have a lot to do this year. In terms of mobile renewal, a target of 224,146 was given to the region, and 114,733 was achieved, representing 51%. A total of 65,373 was given as our target. We were able to achieve 61,289, representing 94%.
The Deputy Director of the Claims Processing Center in Tamale, in a Citi News interview, warned service providers against charging clients with valid NHIA cards illegal fees. Mr. Isaac Akonde said the practice of co-payments being implemented by some health facilities is illegal, and called on service providers to engage the insurance authority before implementing such measures.
Irrespective of the reason, we think that it is illegal because while the services are covered, it's supposed to be free for the members of the NHIS. And any reason why the provider thinks that they need extra money or they need the certain services is more expensive than what we are paying, there's always an avenue for the providers to engage the NHIS on those issues, rather than transferring that cost to the poor patient who are always coming at the time that they are very vulnerable. We also know that most of those on the services we are rendering is for the poor, the poor. Some of them struggle to even get transport to the facility.
Mr. Akonde said the National Health Insurance Authority will sanction health service providers who violate such instructions.
Where we take these monies illegally, the authority would not sit down and look at our provider, our clients suffer some of these things. So some of the actions we are taking is that if we get the complaint that certain illegal payments have gone on, we go to the facility, we go and investigate. Sometimes we contact the complainants, that's the patient. And when it is established that these payments actually went on, the authority have its own way of sanctioning them. Sometimes the service amount is taken from, we take the money from you.
For Citi News, I am Richard Fogo, Damango.